one thing that we could change about medicine in Nepal?
एउटा पेसेन्ट हेरिसकेपछि एउटा ल्यापटप लिएर हरेक राउन्ड्समा जाने सिस्टम छैन हाम्रो अल गभर्मेन्ट हस्पिटल्स should start EMR at first.
You've just finished your USMLE and then you've been to the US.
Yeah.
And then now you're observing at camps. What has that been like when you step into Nepali hospitals after having that experience?
I really feel कि यहाँनिर चाहिँ अलिकति डिफरेन्सेस इन स्ट्यान्डर्ड चाहिँ छ.
Right.
काम गर्न त्यति रेकगनाइज छ कि छैन यहाँको लाइक सो कल्ड सिन्डिकेट एन्ड एभ्रिथिङ.
What certain sectors within digital health that we should really tap into?
Smooth integration गर्नलाई maybe NMA, NMC and the health ministry. They have to come to a table and think for long-term plans.
Yeah.
Why isn't our government like thinking in this way?
Even a toddler knows how to use a phone these days.
Yeah.
The one Nepali hospital that's actually doing digital health well.
Camps?
Most useless digital health initiative you've seen in Nepal?
I think they're so useless, I have not seen them yet. Yes, standard of care, like be it research, be it advancement, and the amount of improvement that we can bring into Nepal after training somewhere in US, that's the main reason that I'm planning to leave.
You went to Nepal Medical College here,
Yes.
right? That's where you graduated from. Was technology involved? Any form of the learning process? And this is medicine in Nepal in 2026. That almost feels like 1980s. Previously on Chatter on the Streets, we opened up Nepal's digital health gap. The broken systems, the missing infrastructure, the patients failing through paper-shaped cracks. But one voice was missing, the Gen Z Nepali doctor, the one who learned medicine on apps and tablets, then walked into a hospital where the patient file is a tattered notebook. Fluent in tech, fluent in frustration, and the one who will inherit whatever we build or fail to build. Next. Dr. Biplov, thank you so much for making the time and for joining me here at Chatter on the Streets.
You're welcome.
Perfect. Okay, so you've just finished your USMLE.
Yes.
And then you've been to the US.
Yeah.
Under some sort of observership.
Awesome.
And then now you're observing at camps.
Awesome.
Right? What has that been like when you step into Nepali hospitals after having that experience?
I think I have carried some knowledge and information that's all over the world, and I really feel कि यहाँनिर चाहिँ अलिकति differences in standard चाहिँ छ.
Right.
So, but I am still not sure how I can put all the information and knowledge that I've acquired into the practice here.
Okay. But what has stood out to you about CAMS? And for those who don't know, it's the Center for American Medical Specialists, and that's where you are, where most of the Nepali doctors are US trained, and they've come back despite the challenges. So that's something commendable, I would say. But yes, what's been your take when it comes to EMR or digital health at CAMS?
So far, I think it's much better than what I've seen all over the places in Nepal. So it does have some AI integration as well, so voice to text and translation pani cha. It has made a lot of differences in longitudinal care of patient, I guess, and I think the patient ko hassle pani a lot easier bhako cha. They don't need to bring all the reports huncha ni. So त्यसले गर्दाखेरि पनि सजिलो चाहिँ छ. So I think, but there still needs some improvement maybe.
What area in particular?
Well, I think user interface, that's the first thing I'd like to comment. I'm not sure if I'm allowed to say this, but alikati user interface ma चाहिँ improvement चाहिन्छ जस्तो छ. अलिकति difficult छ पहिलाको रिपोर्टहरु निकाल्नलाई. So, but I think it's just being developed. So with time, it'll be right there.
Okay. So, do you think this is a myth when it comes to some of the doctors here? Or let's just talk about the senior doctors, right? Like here on average, people are seeing 60 to 80 patients, right? And so some of the doctors challenged me by saying, hey, at least, abroad, it takes forever to get into some kind of specialty clinic, but here we're able to see. And then you compromise the patient time, like if we had EMRs. Do you think that's true?
I really don't think so. I think maybe we can find ways to diminish the time for processing EMR. We can scan, we can use optical character recognition,
right? And
we can also use AI voice to text translation. I think if we prioritize ultimately the standard of care, quality of care, then we'll definitely come to a point where EMR should be integrated, and which definitely improves delivery of healthcare. So
you went to Nepal Medical College here, right? That's where you graduated from. Was technology involved? Any form of the learning process?
Learning process ma चाहिँ मैले खासै त्यस्तो रियलाइज चाहिँ गरिन. We basically used a mostly traditional way of teaching, but recently alikati change bhako bhaneko audio visual presentations. I think that's the only technology, like slides and stuffs.
Right.
But by internship, there is definitely some integration of health information management system. That's making some easier. But ultimately, patient ko care ma use hune chai paperwork nai ho.
Right. Because I think, what are your thoughts about trying to introduce, like you just kind of mentioned so eloquently, was introducing some of the health informatics. But I think we need to start there, right? At the MBBS level.
Yeah.
It's like introducing, because you guys are so tech savvy already, despite not going through despite going through the traditional way of learning. You guys have just kind of taken it upon, right? Like, think about, even a toddler knows how to use a phone these days. So why do you think that's not happening here in Nepal?
I think there are a lot of factors to like take note of. I think one thing is like the variation and kinds of health services we have all across Nepal. From health post in Dolpa to we are talking about MedCity or like any private front tech hospital in Kathmandu. And how do we bring them all together at the same platform using the same resources? And the next thing would be like how to make everyone aware, like, and realize how important this is, considering like we have to make sure like we utilize the resources well. And then the difficulties are, I think the people were not been used to technology all their life, and sudden transition the next day.
Right. So, but do you think that's just become an excuse now? Because this is 2026 and this is medicine in Nepal in 2026. That almost feels like 1980s. But and we're talking to the young doctors. Like, I would like to see an incentive from the young doctors asking for something like this. But I think we're just molded into, 60 to 80 patients, like somewhere, why aren't we seeing doctors advocate at least for these changes? I know money plays a big role, right? Salary. So, it takes me to my question of, you graduated from Nepal and now you're headed towards the US. Did you ever consider wanting to stay in Nepal, or that has always been the way of thinking for most of the young Nepali doctors?
To speak personally, I'm not still sure like if I'd like to be in Nepal or like be in US. I just wanted to do my own training in US, so that's my priority. But I haven't ruled completely out that I'll not be training in Nepal if the circumstances arises, because the family, society, and and how rewarding your work and how do you feel and where do you belong, all these questions you have to take into and then process, like if you really want to train there or spend your life. And then always there are some trade-offs that you have to make.
Absolutely.
Choosing. So, but having said everything, standard of care, like be it research, be it advancement, and the amount of improvement that we can bring into Nepal after training somewhere else, like somewhere like in US, that's the main reason that I'm planning to leave.
Right.
So because I get to learn so many things and that I can bring back always.
Absolutely. I think we need to mobilize expertise, and we also need to, the exposure is beyond comparison to like what you'd be able to bring into Nepal. I think we definitely need that. The US, like the diaspora that we have, right? But somewhere I feel like it's become more for comfort, because you go to the US and then you kind of get into that mesh of life there. And then there's this hope of, okay, the diaspora might come and help mobilize our expertise, just gets lost kind of in the wind, right? And because you just get comfortable, or just it's the way of life in the US too.
I think, and also like like that's a big question. We don't know where to put land our foot on.
Right.
We have been trained there. We have been used to the society, maybe the family, maybe the new expectation, and then the big American dream.
Exactly. The white picket fence.
Where do I start from? Network छ कि छैन, how helpful the society is here, like यहाँ आएर काम गर्न त्यति recognize छ कि छैन, यहाँको like so called syndicate and everything, काम गरेर नयाँ कुरा contribute गर्न, त्यो freedom, त्यो confidence, अनि एउटा हुन्छ नि जेसुकै होस् like भन्ने एउटा confidence लिएर आउनलाई we need to have a lot of a security back in our head. So
absolutely. And I'd be a hypocrite because I've lived, abroad majority of my life. But I think this time I have a new perspective in terms of Nepal and healthcare and all things medicine in Nepal. But I think you guys are the future of Nepal. And if we have this mass exodus, and the way most Nepali doctors think is, let's just go. It's not just for exposure. That's huge. I think we need to get the exposure, because when it comes to technology, evidence-based practice in Nepal does not quite exist. The way we see patients. I don't know. Do you think so?
Yeah, but I cannot completely say that evidence-based practice completely छैन भनेर, but I think there are a lot of gaps where we can improve हुन्छ नि. अब recent findings ले के भनेको छ, पेशेन्टको स्ट्यान्डर्ड केयरले के भन्छ, हेल्थ प्र्याक्टिस अल ओभर द कन्ट्री कति सिमिलर छ, यो सिमिलर कम्प्लेन लिएर तपाईँ एउटा ठाउँमा जानुभयो अर्को ठाउँमा जानु भने प्र्याक्टिसेस कति डिफ्रेन्ट हुन्छ, लाइक हाउ हामी प्रोटोकलहरूसँग कति स्टिक गर्छौँ, एन्ड देन एभ्रिथिङ हुन्छ नि त्यो सब सँगसँगै पेसेन्ट फर्स्ट भन्ने प्रायोरिटी हामीले कति राखेका छौँ, पेसेन्टको इम्पथी एन्ड देन एभ्रिथिङ यो सब राखेर अनि 60 पेसेन्ट्स टु 80 पेसेन्ट्स अ डेलाई कसरी म्यानेज गर्ने भन्ने कुरामा आई थिङ्क द प्रब्लम इज वी आर नट टकिङ अबाउट हाउ टु ब्रिङ अल दिस टुगेदर.
Right.
We are just thinking, staying like this is how it's going, but we are not talking about how we can improve. Like,
right. So who's going to do it? Because if you guys are leaving Nepal, who's going to take this responsibility? When I think, again, that's an easier way, right? Nepal, but I'd rather have a lifestyle and make the money, get the exposure. There's nothing wrong about that, right? But ultimately, I think we need a group of doctors that want to shape Nepal and don't, like Dr. Adhikari mentioned, like coming as a job seeker, but as someone with that spirit of entrepreneurship that would come and mold Nepal. So on that note, maybe we can talk more about like the digital health in Nepal, right? For now, yes, there's an aspect of EMR that feels like a printer. But for you, where would you start? Like even just having a patient app. Like, Hamro Pathar's honey, right? We don't have to create something fancy. Or do you think we can just use that to be able to get some patient information? Like, hey, I'll take an appointment. Hey, these are your medications. Let's just start somewhere simple. What's your thought?
Yeah, definitely we have to start somewhere simple so that we can integrate on every place. A little improvement भएको देखिन्छ हुन्छ नि, but like I would like to see something coming up that can connect health post to hospital. किनभने अहिले like recent integration of national health insurance ले गरेर पनि some places it's been like amazing, एकदम राम्रो रिजल्ट आइरहेछ, फ्यामिलीहरूले अफोर्ड गर्न सकिरहनु भएको छ, तर क्वालिटी अफ केयर त त्यो हेल्थ इन्फर्मेसनमा चाहिँ मिसिङ छ हुन्छ नि. सबैले त्यो फोटो हेरेर यो इज दिस रिपोर्ट अर इज दिस इन्भेस्टिगेसन भ्यालिड छ कि छैन भनेर चेक गर्नलाई पनि वी डोन्ट ह्याभ इनफ इन्फर्मेसन. अनि त्यो सबैभन्दा पनि पेसेन्ट सेफ्टी नै कम्प्रोमाइज हुन्छ डेटा नहुँदाखेरि. अब खाइरहेको मेडिकेसनसँग ड्रग इन्टरेक्सन भइरहेछ कि, ट्रान्सक्रिप्सन एरर भइरहेछ कि,
that's a big one, 60 to 30%.
अनि त्यसको ट्रान्सक्रिप्सन एरर भइरहेछ कि, people are not aware मैले के औषधि खाइरहेको छु, so they cannot speak. Health literacyमा इम्प्रुभमेन्ट आउँछ, अनि long term अब alarms, there are so many things we can talk about.
So give me one place we should start at least, because I think everybody loves to talk about raising awareness, myself included. I think we need to pick one thing that would help bring a significant change in how we practice medicine in Nepal. And so your perspective on that would be?
For like digital health?
Yes. Like where can we start? Or just one thing that we could change about medicine in Nepal?
There are so many.
I know, but you had to. Like,
I mean, like if it's specifically about digital health,
right?
Digital health, maybe we should make everyone have like access to their digital app or like digital records. And be it like any government hospital, we have to start from government hospital. So if they have like any health information, they can go, be it in cloud, they can go and see what's their record so far. And be it bachako vaccination report, unharko health tracking, unharko त्यहाँको issue देखि लिएर long term pregnancy मा आउने medication. So all government hospitals should start some kind of EMR at first, then we can build on that. But we have to come into play, like we have to take into consideration like how to bring into all these quick patient examinations, like loads of volumes of patient examination, and त्यो data like कसरी convert गर्ने भन्दा maybe we can use some OCR or like scan गर्ने के राख्ने, or they can upload हुन्छ नि गइसकेपछि they can just click the picture and just upload.
Actually, that would be super helpful.
Yeah, just hospitalबाट गएर किन भन्दा पेशेन्ट ह्यान्डी हुन्छ. अब त्यसले गर्दाखेरि चाहिँ अब like how tech friendly are our हुन्छ नि patients.
I think we can. I mean, this is 2026.
Yeah, at least those who can do would start, or like हुन्छ नि फ्यामिलीमा कसैले गरिदिनु हुन्छ. So I think that's the first place we can start. But we have to make sure or look like matrices and indices हेर्नु पर्छ कि like कति investment, कति improvement आइरहेछ भनेर. किनभने we have just been doing things and we are not result oriented हुन्छ नि mostly. So त्यो improvement लाई पनि हेरेर के plan बनायो भने चाहिँ I think it won't take much हुन्छ नि to see the improvement.
So what do you want to tell those graduating, those are your juniors, in terms of if they also have the same outlook on life? It's like, hey, MBBS hune bitike, I'm going to go. Not that everybody gets to go, because of life circumstances. But what would you tell them in this day and age when it comes to all the opportunities that could be created in Nepal. But I think we just have one way of thinking. It's like, let's just go this way. When we are frustrated with the way the system is in place, and our senior doctors might not look at, how we practice medicine and think about changing it, because it's just easier. You take paper, breathe in, 3-4 minutes, why would I want to change that? But we're not bringing in quality care. We're not providing patient safety, right?
I think definitely we have to हुन्छ नि हेर्नु पर्यो यो EMR ले क्वालिटी कन्ट्रोल गर्न मिल्ने कति ठाउँहरू छ यो कुरामा अवेरनेस हुनु पर्यो हुन्छ नट जस्ट टु पेसेन्ट्स बट अल्सो टु डक्टर्स अनि एकदम स्विफ्ट इन्टिग्रेसन कसरी हुनसक्छ भन्नेमा चाहिँ टेक अथवा नयाँ डेभलपमेन्ट हुनुपर्छ हुन्छ नि अब मेबी वी क्यानट युज समथिङ द्याट्स लाइक बिन प्र्याक्टिसिङ इन युएस सिधै ल्याएर यहाँ इन्टिग्रेट गर्न गाह्रो हुन्छ किनभने त्यो एडाप्ट गर्नलाई एउटा पेसेन्ट हेरिसकेपछि एउटा ल्यापटप लिएर हरेक राउन्ड्समा जाने सिस्टम छैन हाम्रो हुन्छ नि द्याट्स नट हाउ वी डु इट हियर बट वी हेभ टु फाइन्ड एन्ड डेभलप वेज टु इन्टिग्रेट हुन्छ नि लङ टर्म हेल्थ इन्फर्मेसन हुन्छ नि बी लाइक डिजिटल हेल्थ अथवा बेसिकली वी आर जस्ट सेइङ कि हाउ टु handle patient data that is so crucial and save it so that we can process it for them and for doctors to give quality care. So त्यसको लागि we have to like start some talks like this, or maybe with like some more like experts who we can like integrate and find new ideas and innovation. So that's the first thing. And in terms of like advice to young people who are just graduated, I think they have to first look into themselves and realize your sabai dekhirako dream, if it's their own or if it's just society le dekhiracha just chaliracha, just I think we just need to figure out life, sometime take some break, look at ourselves, look within, and then decide where we can make the best impact and where we can grow the most, I think. And we have to judge.
Well, do you think we're going to have AI or some kind of a comprehensive digital health system in Nepal in 10 years?
Yeah, at least in some places. So we will.
With
like,
some capacity.
AI is a big term. Like, if will it come into like image analysis or like text to your voice to text? अब कुनै न कुनै सेक्टरमा चाहिँ AI definitely आउँछ किनभने क्याम्पसमा त already एउटा छ.
Right.
So that's
more
one
interoperable.
Kind of,
yeah, that's where, because I think for me, I want it from patient to pharmacy, because if we can just stop the adverse reactions through file मात्रै upload गरेर within the hospital communication. I know there are a few, like maybe 5 or 6, but it's not used in the capacity an EMR could be used. Digital,
definitely.
But I feel like it's a namesake. I wanted your perspective as a young doctor in Nepal who is tech savvy in terms of what certain sectors within digital health that we should really tap into.
Yeah, that's as you said, your front end pharmacy that integrate is foremost that you realize. But when I look at the problems, it looks like networks of threes. If I pull one, it's gonna be more mess. So I think we have to find the right problem and त्यसपछि त्यसलाई कसरी इन्टिग्रेट गर्ने किनभने यही हेल्थमा पनि एन्टिबायोटिक जसरी युज भइरहेछ देखि लिएर अब ड्रग alarm settings गर्न मिल्छ. There are so many things, but where do we start? And त्यसपछि guidelines and त्यसपछि हुन्छ नि यो सबै like in smooth integration गर्नलाई maybe NMA, NMC and health ministry, they have to come to a table and think for long-term plans.
And not just say money is a big factor. Yes, it is, but I think we have the funding. I think we have the funding to make this a priority. I think patients don't know how to advocate for themselves. They have no idea. File book it. I mean, it's my recent experience. I've been carrying files like MRI files and carrying it everywhere because people, you get asked the same question. Hey, so what's your history? What's this? What medications? And a 90-year-old would not be able to explain that, right? And so much gets missed in it. So I think for me, it's more of the patient advocacy as well as for healthcare providers, and not thinking it as like this is going to be more time consuming, because the initial part might be, but then it's going to create efficiency and patient safety. Let's not forget that.
Definitely. Patient advocacy, like, and patient rights awareness. These eventually, if you start somewhere, everything will come, and then. Recently, if I can share experience, recently there was a case at some hospital, and this was the patient was asked if she has like long-term oxygen at her home, and then she said yes because her husband was using it, and then the confusing when the patient was not even diagnosed with COPD, and COPD with long-term oxygen therapy because they just like it was going on so quickly.
It's shared medicine or shared.
And they just thought like she's using it, wasn't it?
Right.
So because if we had like EMR and this was drug reaction, there's so many examples, but like
I think that has become more of a priority, because I think we can talk about salary on the side, but if for the doctors that are already here in Nepal and are choosing not to go or prefer to be in Nepal, I think their life needs to improve through EMRs. And I want people to have a different perspective on what an effective system that actually is when we utilize it in the right way. Okay?
Yeah, definitely.
I know. Yeah. Because you've had both experience, like the US and here. And so I'm sure when you walk into any like government hospital and to go through the paperwork system, the first thing I could say is just frustrating in a way, because how much time do you have to understand somebody?
Yeah, it's similar हुन्छ नि हाम्रो गभर्मेन्ट हस्पिटल अथवा गभर्मेन्ट कार्यालयमा जाँदाखेरि जस्तो एउटा फाइल बोकेर कतिवटा ठाउँमा जाने पेसेन्टलाई थाहा हुँदैन, लाइन कहाँ बस्ने, अनि सेम कुरा देखाउनु डक्टरकोमा कसरी जाने, लाइक अल दिस थिङ्स डेफिनेटली कुनै ठाउँमा कस्ट इन्क्रिज हुन्छ बट कुनै ठाउँमा कस्ट रिडक्सन पनि हुन्छ. सो वी जस्ट ह्याभ टु मेक द बेस्ट वे, एन्ड आई थिङ्क इट्स जस्ट अ म्याटर अफ लाइक फ्यु thoughtful discussions, and then we can definitely come up with something that can help a lot of patients.
I think we need
and
to
also
have,
doctors.
Exactly. So maybe the next time the roundtable will include all these different group of people, like the ministry, the young doctors, the old doctors, and then we just go exchange
I think
debates.
that'll be the good thematic analysis of all the people and their perspective, and then why isn't our government like thinking in this way, or like why isn't our old practitioner trying to adapt, or what are the difficulties? We have to take into consider their difficulties as well, because we can't rule anyone out. So
exactly, किनभने हाम्रो neighboring countries, Bangladesh, Rwanda, or not obviously not neighboring, but Bangladesh would be. I mean, we've already adapted to those systems, and so we're not comparing to like the US or Australia or UK. We're talking about our neighboring countries, and so there's something to be said about. I just keep going back to this is medicine in 2026, and we have young doctors, and there is a surplus, but I don't think so. We're giving them we're not equipping them to survive in Nepal. And I think we're going to have a big problem if we don't really make this an urgency. I would want to go into the path of least resistance and make my life comfortable, right? Like, I mean, that's normal human behavior. And then come back and when I'm retired to think of, let me see what I can change. Right? Like, we could do that. Anyway, I think you've answered some of the questions I wanted to understand from a young Nepali doctor's perspective, who's actually been to the US and now here under, CAM's observership. So I think it's very helpful. As you've mentioned, some of the frustrations, somewhere it's like, where do I start? I think that's what I'm getting. Like, कहाँबाट सुरु गर्ने?
एउटा सञ्जाल, it's a network of like mesh, and this कुनै एउटा ठाउँमा देख्यो भने, where do I start from? Like, what are the priorities I need to make? That's the most difficult question to answer.
Okay, well, you may think you're done with the difficult part. We're going to enter into the rapid fire questions. Okay. One-liner or one word. That's all. Your medical college's digital infrastructure in one word.
5 out of 10.
Okay. The one Nepali hospital that's actually doing digital health well.
CAMS.
Okay. Most useless digital health initiative you've seen in Nepal.
Useless?
Useless.
I think they're so useless I've not seen them yet.
Okay. WhatsApp consultations with patients. Do you think that's ethical, or it's just kind of more like an eye roll?
Somewhere in between.
Okay. Because, when you think of the diaspora of all the Nepali doctors that are abroad, they're learning, they're getting exposed, right, to all the technologies and modern medicine and everything. And if they could channel that for Nepalis here, I think it's useful, whether we do it through WhatsApp or any.
That's my point. Like, if the patient is being like benefited from that, then I wouldn't be rolling my eyes on that.
Right. I know, most times.
And and I think that people like somewhere एउटा सानो report को लागि, एउटा सानो follow up को लागि, you're traveling and then like spending 2 days or like spending some of your amount of money just to say like, just continue the same medication.
Right. Exactly.
And if that can be done in like WhatsApp, or be it Messenger, or be it like Viber, I didn't care.
See, now we're getting to it. Now we're getting to it. Okay. Will Nepal have a unified patient ID by 2030?
I really wish for that.
Okay, you're not giving me too much hope as a young Nepali doctor. I need more of that. Okay. The biggest barrier to EMRs in Nepal: doctors, government, or patients? I have a feeling you're going to say all.
All of them. All of them. And if I have to like give the priority, government, doctors, and then patient.
Okay.
That's in the like descending order.
Okay. What about telemedicine in rural Nepal? Real solution?
Yeah, some solution.
Okay, because we're so spread out that it's always hard to like connect. I think that's challenging, but I think if we could, that would be huge.
That'd be huge. Like Nepal is a country of tourism and like altitude sickness, mountain medicine. Like even for like the new tourists, they come visit and they can't be accessing like medicine at Annapurna base camp. But if you start with telemedicine, like they will feel safe. This will ultimately change the face of our like Nepal.
So maybe that's where we start.
Yeah, that's telemedicine is like.
I mean, they've started, but like to make that something that's accessible for everybody. Yeah. One Nepali health tech startup worth watching.
I think I've just recently seen Mero Manche and I'd really like to follow them up. And then I really have something in my mind. So I'll be saying that if I get like next episode with you.
Oh, okay. I like that challenge. Okay. Don't leave. Let's not leave.
Okay.
If you had 1 crore here, where would you use it to change the face of medicine in Nepal?
That's the budget?
Yeah, that's the budget. 1 crore.
Do I get to influence people or do I need to develop something?
However, it's in your hands. You get to do it. However, as a young Nepali doctor, because you've had
I'll use that money to like raise more funding.
To do what?
So that I can make some policy level changes and make some start some startups be it like a health work something. I'd like to work on like preventive medicine through like digital health. Yeah. Through digital health.
Perfect. I think you summarized the whole topic right now, because I think we do more of preventive medicine is like on the back end of like how we see. It's more reactionary medicine.
It's in the background and it's like out of focus.
Yeah. Like that's why Nepalis think.
Even like I'm doctor and मेरो चिरेको साथीहरुमा पनि like last time we took our moms to mammography, like I'm not sure like हुन्छ नि and like the pap smear or like colonoscopy. And like that त्यति मात्र हैन, like long term life illness like be it hypertension, diabetes. I don't think like it's preventive medicine world ma नै lag भएको कुरा हो, be it US, be it Australia हुन्छ नि.
Exactly.
Hypertension छ तर like lifestyle changes को advices हरु like के गर्ने त भोलि बिहान गएर exercise गर्ने, where do I start from, like do I go for we don't have like structured guidelines for preventive medicine and I really want to change that.
You just gave me yourself actually a reason to come back.
Maybe
if we can get a little bit like a channel for EMR and get the ears of the policymakers, I think that would be wonderful, like advocating for patients and family, because you're right. Like even basic screening, cancer screening should be in our package as providers. Like people are aware
be it like diabetes भएको कतिजना छ like हाम्रो right diet approachहरुसँग हामी त्यो consultation doctor consultation मा कति हामीले we can be aware of that अनि गर्ने exerciseहरु long term like if we just keep on addressing our long term illness through medication, then we can never come out of it. They EMR ma bill garde bhayo you're due for your screening, like just we're not creating something new. We just need to have like timeline and then there's time fixed alerts haru ayo bhane like once I'm like 21 I get the alert to my pap smear, or like 40-45 my colonoscopy
all cancer, breast cancer screening, everything that we need to do that. So maybe that's where we streamline with digital health, is just give us that for now. Right.
And we can definitely integrate the upcoming nutritionist and trainers and then physiotherapy, and then that will be a platform we can connect, and then that's where we can give them the holistic approach to like treatment.
But Dr. Biplov, like, do you think like we're talking about what's already existing? And we're talking about let's just bring this to Nepal. And that is where it's hard for me, because I don't think Nepal is any longer a least developed country. Okay, we're now transitioning into a developed country. And so I think those would be some of the signs to see in a developed country is a more modernized healthcare system that includes digital health.
It definitely at the first place.
Right. I know. Exactly. That's good. Is there anything you'd want to say from your end that would be worth summarizing all of this? Or you as the voice of the young Nepali doctors who has experienced both sides of medicine, the US as well as Nepal?
We all the doctors, we have to start thinking collectively for the mutual benefit of patients and doctors, like how to bring the patient first one approach and we need to like raise our voices against the corporate capitalist that's going on, and that's what is not letting change the face of health. I think I think the people right there. I think the people can understand what I mean. But we need to have a collective awareness and the voice against so many mishaps and everything. And I just mean like we need to be together for some change. That's my one word advice. be together for some change.
Absolutely. No, I hope this becomes a unanimous voice right across all the Nepali medical providers in Nepal as we advocate for a better change and improved Nepal. I think we need to see this because this is 2026. That's all I keep saying. That's all I keep saying, right?
We should. Yeah.
Okay.
But really nice.
Dr. Biplov, thank you so much for your time.
Thank you so much for your questions.
It was wonderful having you here.
Yeah, nice conversation. Yeah, really loved it.
Great. Thank you.
Thank you.